Here's what we're learning about RPM, that we can longitudinally monitor hypertension at scale, and it works better than we thought. Now, when you look at remote patient monitoring, and what I mention a lot when I go over some of the data and provide these videos here as well as the blog posts, is that in the first 3 to 6 months, we see a medicinal effect. And what's interesting about that medicinal effect is it occurs in the absence of changing any medications with the patient. So the patients already have an established relationship with their provider. The provider feels that it is medically necessary and beneficial to remotely monitor this patient. So they enroll the patient. If the patient is interested in receiving the blood pressure cuff and participating in the RPM program, then they sign on to it. But they're being initiated in the RPM program without any simultaneous changes in their medication. And then what we do is we look at their first week of data transmission after they learn how to take the proper measurements and so forth. And we compare that first week of blood pressure readings to their most recent week of blood pressure readings. And we follow patients over time. And as I mentioned, in the first, 3 to 6 months, we see about a 14-point systolic improvement in stage 1 or all uncontrolled hypertensive patients, actually. And in the subset of patients with stage 2 levels of systolic and diastolic pressure, we see a systolic lowering that's around 23 points. This is medicinal. It's like another drug or two has been added. And then the blood pressure lowering doesn't stop there. It continues on. And we see even at 30 months, these patients continually improve. Now, what does that mean? Because some people think, well, blood pressure, it's just a risk factor. How big a deal is it? It is arguably one of the most important cardiometabolic risk factors that we want to manage and control. And when we look at studies like the Etihad study in 2016, a meta-analysis published in JAMA, every 5-point reduction in systolic pressure leads to about a 10% lowering of major cardiovascular events. And every 10-point lowering in systolic pressure leads to about a 20% reduction. So if we're looking at this 10 to 12-point improvement over 40,000 patients here in this real-world analysis, now this is observational data, this is not a randomized controlled trial, but this observational real-world data, the 10 to 12-point drop would lead to about 20 to 24% lower major adverse events. So in this group of 40,000 patients, that would translate into around 1,000 less major adverse cardiovascular events, which, if you think about every one of these major events, costs somewhere between $20,000 and $35,000. That just in this group alone, these 40,000 hypertensive patients here, we're avoiding somewhere between $16 million and $42 million of healthcare costs. But most importantly, lives are being saved. Cardiovascular disease is not just the number one killer among Americans. It is also the number one or a leading cause of disability. So when people have a stroke or a major cardiovascular event, disability obviously increases, and it has a profound negative effect on their quality of life. So by monitoring these patients and proactively caring for these patients and giving them care plan goals and lifestyle strategies and building in their health literacy and giving them a sense of control over their health, longitudinally monitoring them for as long as 30 months and continuing to see this lower blood pressure is ultimately impacting lives. And we at HealthSnap are extremely proud of being part of it.